Hi, Bobby.
Hello.
Hey, Robin.
Hey, Jody.
How are you?
Good. How are you doing?
Good. We had,
Good. Snow here in Hazen.
it's, you know what? We were in Hazen on Good Friday.
Oh, you were. I was in Castleton.
Oh, that's, we went out, we drove out there to get a goat.
Oh, a goat. Oh, fun.
Yeah. Great. Well, I think we're gonna go ahead and get started. I just remembered I'm recording that, so now everybody knows that I went out to Hazen to get a goat. So I'm sure that's for everyone. Today is April 11th, and we are on CVI session 4. And today we're going to do something just a little bit different. It's still going to be a lot of information, but I'm going to try to gear this to a case study. Was a case study that I participated in last semester through my classes. I'm not going to require you to go through and watch all the videos and do the assessment. That's already been done for you. I've done that. But here are the results of that so that you guys can kind of see, you know, what it looks like when you have a student that's getting assessed for CVI, and the background information, and then the findings and how those findings can be used practically on an educational level in the classroom. Is the background noise here bothering you guys at all? Okay. So we have Stephen is going to be our case study student. He is almost 6 years old. He has a very sweet disposition, and in the videos he's got dark hair, and he's ambulatory, but he does have a CP, so he generally walks with like a walker or some kind of assisted mobility device. He was born at 25 weeks gestation, and resulting from that, he has cerebral palsy and some developmental delays. He does have a history of seizures and CVI. The phase he's currently in now, we know that there's phases 1, 2, and 3 for CVI, and this little boy is in phase 2. Phase 2 is generally the most common phase overall. However, a lot of the kids that you might see in your day-to-day work environments could very well be like the phase 3 kids, and they might have like kind of slipped through the cracks and be a little harder to spot. So excuse me just a minute, I'm going to shut this so I can not have the blinds rattling behind me. Now, if you need me to try to move the pictures around or whatever, let me know that, and I can try to do that if you can't see the screen. So Stephen is right now receiving services for special education. He also is getting OT, PT, speech language, and vision services. So what we know about Stephen is that 3 main things really help support Stephen's visual functioning. If he has auditory cueing, that is like to say his name, Stephen, and then prompt him on something. Stephen, and whatever it might be, look at, you know, let's look at this. That auditory cueing is very important for him. Hi, Katie. Then he also does much better if he's told what color an object is. So if you say, for example, if you have something like this, I don't know if everybody can see that, but Stephen, look, here's a red Braille dot. Well, that would not be probably something he'd normally be looking at, but just for an example, the color. And then Stephen also functions much better if he has an organized, predictable environment. As you can see, this isn't probably a lot different from your typical kid. I mean, we all probably would do, except for being told an object's color, better, you know, with an organized, predictable environment and maybe with some cueing. All right. So Stephen, when he was assessed, he scored a 5 on rating 1, and that means he's starting to use his vision functionally. He's not only identifying and recognizing things, he's starting to know what things are being used for. He also scored a 5 on rating 2. So if you remember from our past sessions, 0 to 3+ is like phase 1. 3+ to 6 or 7 is phase 2, and 7+ to 10 is phase 3. So he's solidly in phase 2. His highest score was in the visual reflex response. Now remember, this isn't something that we always assess. Dutton's, the different assessments, not every assessment measures this, but this particular assessment was done with Roman Lansky's CVI assessment, characteristic assessment. And so this is a characteristic that is included on her evaluation tool, and that's where he scored the strongest, and he scored the lowest in distance vision. So remember again that distance vision isn't necessarily an acuity thing. It may be that they need to have things up close so that things are less cluttered. Okay. All right. Stephen's CVI goals. Now this would be something that would be written right into his, like for example, his IEP. Or that the team has identified, you know, that these are the things that are getting worked on. To continue to integrate vision with function in all areas of his daily life. To increase visual attention, especially regarding distance viewing. So that's identified as one of his weaknesses. We want to make sure that that's being addressed. To increase visual recognition by distinguishing salient features. Does anybody remember what a salient feature is? Anybody remember that? Yes, no? Katie, I can't hear you. I don't know. Can you guys?
Sorry, I was gonna say more like those like super like detailed features.
Yep,
Like,
it's the distinguishing things, like how we would tell a cow from an elephant. Okay, an elephant would have a trunk, he'd be gray, there'd be, and we're learning now this semester that some of those features that don't ever change are, they're just called an invariance, which if you ever hear that, that's how people will talk. It's either a salient feature or something just never has a variance. So, okay. And to increase visual recognition by distinguishing salient features, yes, and identifying 2-dimensional images. Mostly right up until this point, he's been using 3-dimensional real objects, okay? And then to combine vision with cause and effect and with touch. So that he, for example, a good example of this would be a switch, right? Or, you know, when he touches something that there's some kind of a response. In our class, we ended up having to do like an activity box. And in that activity box, we were to put things in there that Stephen could use. So we had to use things from around our own home I was lucky enough that my husband Lonnie helped me with mine in terms of the engineering aspect of it, but we like mounted a red Jello mold, an aluminum red Jello mold, something that he would be able to spin with movement. We added a light switch in this box so that he could turn on a light. Just different things, you know, you can get as creative as you want to with those kinds of things. All right, so we're just going to start talking about Stephen's visual behaviors and the strategies that go with them. Now, if you remember last time we had those 10 characteristics, and the first one we talked about was color. So with Stephen, the impact of color, he prefers brightly colored and or highly saturated objects. Okay. So an example for him could be, and again, think about the students that you have. This maybe could help any student. The things that I have to share in terms of strategies, you know, it just in our graduate class group, when people are kind of brainstorming in different things, these are things that, you know, a lot of teachers, special ed teachers, just find helpful generally. So you might want to just take note of some of these things because, and maybe you're already using them. But highlighting and outlining containers with bright tape or colors can help Stephen or other kids with that sorting or visual reach. Using brightly or highly saturated colors in presenting target items. Another thing is like the shiny Mylar, you can get like Mylar tape or Mylar film to put over things, and it has kind of a reflective quality. That's another thing that can be helpful. The red tape, like here, the red duct tape, for instance, can help. You can put that over like a door frame, around a door frame to outline things so that kids notice those visual cues more readily. You've probably noticed when you're walking upstairs some places, there'll be a piece of red tape on each step. And that's, again, just one of those visual cues. So if you look at what his visual behavior is, or whatever students you have, their visual behavior, in this case, we know that he prefers brightly colored objects, then these are some strategies we're going to use to help prompt him. Okay. Then we're going to go to the impact of movement. This was the second characteristic that we see in CVI as kids have different responses to movement than most kids. That's, you know, they'll notice shiny or reflective things. So Stephen is attracted to objects that have movement. Okay. He likes to look at items that are being moved or in his environment that are shiny or reflective. However, movement may distract Stephen. So there's kind of two parts to that. He likes movement that can get his attention, but if he's attending to something, movement out here can also distract him. So strategies are to be able to use movement when presenting an item to him. So we would do like an auditory visual cue, look at the red braille card, but then we do this kind of movement thing so that it catches his eye, okay? Now it says especially in Stephen's peripheral fields. And if you remember me talking about that often kids with CVI will have field vision neglect. They might catch things on the periphery. They may have some center vision loss. They might catch things on the periphery more easily because that's a lower based vision. That's kind of a survival technique vision. We catch things off of in our periphery, you know, as a kind of a survival technique. Again, like a reason for that would be, an example for that is like when you get your driver's license, you have to be able to see so far out here, and that's, you know, so that you can see items that might collide with you in your environment while you're driving. Well, that peripheral, that's a lower functioning kind of vision, and that oftentimes remains intact with kids with CVI, as it has with Stephen. Okay. He likes to move himself. You all know kids that might like to be moving. Okay. And so the suggestion is to allow him to change positions, to look at materials from different angles. Okay, you know, we don't often think about this. When we have typical vision or we've had a typical visual development, we know that, for example, I'm going to grab something here. If I look at a cup this way, it's a cup. But if a kid with CVI sees a cup turned on its side, they might not necessarily recognize it's a cup. Okay. So that's why we want to allow those kids to be able to look at things from different angles and start making that generalization. You can present materials from different angles and heights, and then when he's in different postures. For Stephen, we'd use items that are shiny or mimic movement. Getting kids with CVI to kind of attend to faces. Sometimes we use mirrors so that they'll start to like have their own facial regard. And then apply shiny or reflective material onto novel, new objects that you're trying to introduce into Stephen's visual regard. Now, most of you guys don't work with kids that are probably this low functioning in terms of, you know, their limited mobility, and we just don't seem to, you can think of some, I mean, but think of this too on a broader scale, if you would, with kids that you have on your caseload that, yeah, you know, I've kind of noticed that about, that seems to ring a bell with me. And as we go through these, it might help you kind of make sense. Now, this is something particular to Stephen, is a latency for looking and understanding. He needs to have a warm-up period, like in order to use his best visual skills. You know, like when you have circle time in the morning in preschool, for example, that's kind of your warm-up time, right? You're getting the kids acclimated to the school day, you're getting a routine set. It's the same thing when you start working in any, probably with anything, you have a little bit of a warm-up time, get the kids acclimated. The same applies to vision. This is an area that latency is kind of one of those telltale signs of maybe something's going on. In terms of CVI, if you have a child that, you know, delays in a responding, or, and maybe it's not necessarily in looking at something, but in processing what's being looked at. Okay, that's a real significant difference. They might see an object, but the child might not be able to understand that object. So Stephen has increased latency in both areas. He has increased latency when he's viewing novel or unfamiliar objects. And then he shows latency for understanding once he does see an object. And latency also increases when Stephen is ill or fatigued. Okay. I'm going to kind of like just think about some kids maybe in the high school, junior high, high school area that you might, you might be thinking, you know, it just doesn't seem like they're reading like they should, or they're not processing math like they should. You know, I'm not saying that every single kid that does that would have CVI, but these are those typical characteristics that help us identify that. So we would then allow a visual warm-up time. And then, this is really important, we'd allow Stephen ample time, at least 15 to 30 seconds. Last time I kind of timed that out just because that feels like such a long time. Our typical response waiting time is maybe 3 to 5 seconds, generally at the most. We really have to stop and give these kids time to process, and then to locate and look at materials that are presented. And then using a familiar object to initially alert visual attention, and then allowing Stephen time to locate, look, and understand what he is seeing. if you have, and this is just kind of a side note thing, but if you have kids that you know have like maybe a metabolic disorder or some kind of syndrome, whether it be variant syndrome or Down syndrome, or, I mean, just keep in the back of your mind that when there's brain involvement like that, there is an increased chance that there is also something affecting that child's ability to process their vision. Okay. So now we're going to look at the characteristic of visual field functioning. So in this case, in Stephen's case, he demonstrates a preference for his left visual field, and he often just doesn't see items in his right field. Okay. He will consistently look down and to the left with his whole head. You might see kids doing that. You might see a kid who's using their whole head to look instead of just moving their eyes. Okay. And then Stephen likes to look at people and objects about 6 to 8 inches from his face and at eye level. So he would like things right front and center, kind of here, when he does finally notice them. You can present them from the left, okay, but then bring them up, and that's where he finally likes to kind of rest his gaze. So strategies would be to approach Stephen from his left side, and then starting from about an 8 to 10 feet away, you could move in towards him and then come into 2 to 3 feet for his best viewing range. Okay. In Stephen's case, he would need to be physically supported in a wheelchair with a chest strap to help him use his vision more functionally and be turned in an angle if necessary, so he can access like the lower and left visual fields, and then present initially objects to Stephen in his peripheral fields with movement or shininess or something that mimics movement to get him to look. So now we're going to talk about difficulties with complexity. And remember, we talked about before, you know, we've had kind of a 2-week break here, but complexity is really the big issue, the main issue with CVI. If a kid has CVI, they could have all these other characteristics, but we're probably almost always going to see difficulties with complexity. And if you remember, complexity is broken down into 4 parts. So it's with objects, and it's with sensory and facial recognition, and oh yeah, an array of objects. So there's 4 different ways we can look at complexity in this area. So for Stephen, he can apply some salient features, his knowledge about that, to novel items. Okay, so he could maybe tell the difference between a banana, for example, and a red apple. Okay, he has a greater latency time when looking at 2-dimensional images, and he likes to touch objects before looking at them. Okay. So for strategies for Stephen, we would let him have familiar objects so he can start visually attending to something, and then we'd progress on from the familiar to the more unfamiliar. We'd allow him to touch objects as he practices looking at them. We would introduce items in 3D or even the real objects, and then again progress into a more of a flat or 2D feature. And we would use photographs, and this is really important. And just think about this with all kids, maybe. Use photographs of real objects. It's really important to stay away from anything that's abstract, and that's really including cartoonish images. So if we want a child to really have a good understanding of what we're presenting, we don't want to be using, you know, sketches or just think about, you know, Dr. Seuss's books. They're great kids' books. They've got color, they rhyme, they do all that. But for a child with CVI, you know, that is going to be harder to make sense of. Okay, because it's abstract. And we don't think about it that much that way. We expect kids, to just enjoy that right off the bat. Well, some kids, when they're looking at things like that, they're not even understanding what's in front of them because it's too complex. Does anybody have any questions on any of this so far?
I just have a question. This is Lindsay. If anyone has used Edmark before, and if they've come across the little take-home readers in something other than black and white, because that's what the one that I have, it has them all in black and white, and so it's just not very conducive to providing a lot of, that those salient features are harder to recognize when it's just black and white like that.
Right.
So has anyone found anything different with Edmark other than the stories, but the take-home readers are the ones that I'm referring to? Maybe not. Okay. Thanks anyways.
Thanks, Lindsay. All right, the second part of difficulty with complexity is objects in an array. So the picture here, you can see that there's like all these different cookies. We can see that they're all different kinds of flavors or different colored cookies. But again, to a child with CVI, this may just look like a kaleidoscope. Okay, it just really might not make sense. So for Stephen, his best visual responses are when materials are presented against non-complex backgrounds. It might be a black background. That might be that trifold black folder we've talked about. Okay. Cluttering consistently interferes with Stephen's visual functioning. So the more cluttered things are, the more distracted he is, the less he's going to be able to perform visually. Stephen likes things to be kept in familiar and predictable places. Okay. Now with that in the chat, if you guys would look at that, I shared a document with all of you, and it's a paper about clutter in the classroom. And I can also send it out to you in an email. You can take a look at that or open that if you'd like to at any point. It's kind of a scientific article, and it's not like just fun reading, but it does a really good job of talking about what clutter in our classroom environments do to a child with CVI, and then strategies how to eliminate or minimize that clutter. For example, putting up a black curtain maybe over shelving so that all the things on the shelves aren't being exposed. Maybe dim the lights so that light isn't, as intense and, glaring, that things are muted. So anyways, just that's for your information. If you need me to send it through email, I can do that as well. I don't know if you guys can take it from there and resave it on your computers. I think you should be able to, but if you need that, let me know. Okay. But that goes right in here with this clutter issue. So, and again, it's really hard because like I was trained as elementary and special ed. Well, we're trained that, kids need to have a lot of stimulation and a lot of, in fact, we used to call it visual stimulation. And there is definitely a role and a time and a place for that. With CVI kids, it's just different. Okay, it has to be more structured. It has to be presented more singularly, and it just makes us rethink how our classrooms are. Now they might seem like dull to somebody else, but when a CVI or any child with a brain processing disorder of any sort, really auditory or otherwise, is in a busy environment with a lot going on, it makes their life kind of like miserable. So So the strategies here then would be to maintain an uncluttered environment so that Stephen here can better visually attend to the targeted activity and or item. You'd organize items in predictable and familiar places. And then you'd use a non-complex, preferably black background to present materials against. Examples might include black fabric background, a trifold black folder, or a black tray or mat to present items. Some people even go as far as they'll wear monotone clothes to school. It doesn't have to be that they're always wearing black, but that they, they don't wear things like, for example, this necklace where it might, distract a child when they're working with them. And we have that difficulty with faces and access to people. So Stephen is one of these kids who tends to look through people. He has inconsistent regard for faces. He has atypical social responses. He won't necessarily smile when somebody smiles at him. He might look briefly at familiar faces. And he has little regard for his image in a mirror. Okay. There again, as you're thinking about students on your caseloads, some of these you might just have noticed or observed kids in different that maybe they're not on your caseload, but it might be a like, I'm gonna check into that a little bit more type of a thing. So a strategy here would be to direct Stephen with a verbal cue to look at a familiar face. Just a simple introduction. Hi, Stephen. It's Mrs. Shear here today. How are you doing? And you know what? It's such a simple thing, but we oftentimes kind of find that to feel silly, especially when we're in the fourth quarter, probably of school, and to introduce, and I forget to do that too. But I always will try to say hi. I don't always necessarily say my name when I'm visiting with a student. But a verbal cue so that they start to recognize your voice with the face is important, okay? And that's what that second one is, introducing yourself to this child as so he associates your face with your voice. Maintain consistent personnel, working with Stephen, you can apply to other students too, so that he can benefit from familiar faces and voices in order to improve facial recognition. And since faces are complex, allow Stephen time to locate, look, and then understand what he is seeing. The fourth type of complexity is the difficulty with sensory. And this little boy, it's kind of probably how some of us feel some days. Stephen likes to be moving, and that vestibular movement, or just that, that's also a sense of being. So he likes that. You probably have students in your caseload who like to be moving. In this particular case with Stephen, his visual functioning increases when auditory or the noise is decreased. Okay. So generally he likes a quiet environment. However, remember at the beginning, we said he likes auditory cues. So he likes a quieter environment, but he likes to be spoken directly to, especially involving faces and people. Okay. So strategies that we could implement, or these would be like recommendations that would go into the IEP, or that we could give to the classroom teachers or to the team, is that you want to control Stephen's learning environment so that it's quiet and not distracting for him. You want to use verbal cues to direct Stephen to look at an object or a face. Remember, those auditory cues help him. Use predictable, familiar sounds to help Stephen attend visually and sustain attention. You can think about that too in just terms of a baby with a rattle. That rattle makes that same sound every time. Pretty soon you have that baby starting to attend to that, okay? Then you're going to have that baby want to eventually try to reach for that rattle. And then you're going to have that baby start to learn to integrate that, looking at that object with its function, shaking that. And that's exactly what we're talking about here. And a lot of this is just visual development stages, or training the brain to see, okay? And then allow Stephen to move and reposition. So. Now we're going to talk a little bit about the light, characteristic of light. If you remember, last time we talked about light has some different attributes. We would think about it not only in the lighting of the room, okay, but in how things are presented. Sometimes backlighting is important. Anyways, we'll look here. His behaviors. So Stephen prefers lighted or shiny objects, okay? And he will look up and to the right and light gaze, especially if he's tired. Do you guys know what light gazing is? Have you ever seen a kid do that? Where they just kind of will stare at a light? That's a pretty rudimentary, a pretty basic, you know, babies will do that. Babies just love to kind of sometimes stare at lights. Also know though that as kids get older, and we'll talk about this in a couple slides later, sometimes light gazing is a way to kind of recharge the batteries. So it's kind of it's a resting mechanism, or it's, so here, if he's tired, if Stephen's tired, he'll just kind of take time and kind of light gaze. But he's defensive. He does not like bright red lights. So strategies here are backlighting. Now, what is backlighting? We've seen those light boxes. That would be one example of backlighting, but also iPads are excellent. They're an excellent tool for backlighting. Okay, you can change the brightness on them. You can change the background color on them. It's Apple does just a great job with its accessibility features, and that's one of them. And so iPads tend to really lend themselves very well to kids who are dealing with CVI. Position Stephen so that the natural environmental lighting comes from behind him, and we've talked about that before. Opening or closing curtains as needed. Control the environment for optimal lighting. That might be having things as, you know, as dark as you can and still being able to see. That might keep things dark, but what you're working on is backlit, so that helps him attend to his visual attention. He can fix his visual attention on whatever is in front of him more easily. And then have like different things on hand, like a light box or flashlights to enhance Stephen's attention or a child's attention on the specific activity or item being targeted that day. Difficulty with distance viewing and visual curiosity and attention. So Stephen prefers familiar to novel items. He demonstrates his best visual curiosity at 2 to 3 feet to locate and recognize items. Stephen shows distance curiosity with strongly saturated colored items. Remember, that was his preference. So he'll look at those beyond 4 feet, and he will notice moving people, because he likes movement, and larger objects in the environment at up to 8 feet. Especially in Stephen's case, if somebody is speaking to him as they're moving toward him. So a strategy would make sense is to place Stephen within 2 or 3 feet of materials and items to provide the best opportunity for him to attend visually, and then to use strong colors to attract Stephen's attention past 3 feet. Difficulty with visual novelty and visual recognition. So this is kind of a biggie with a lot of, and it kind of goes sometimes hand in hand with that complexity issue. So when Stephen quiets down, this is how you know kind of when a child is recognizing or understanding something. And you usually have to observe that child or have been working with that child or be talking with the parents to know, like when Jenny, you know, blinks her eyes, then we know that she sees that item. Or, you know, if a child is reading and they say something, or they they use a different route to get to the information that's being presented, you know that they're engaged, okay? And that's what this is talking about. When Stephen, for example, quiets down, smiles, or reaches for something, these are all signs that he sees and recognizes an object. Now remember, seeing and recognizing an object is different than understanding what the object is used for. So there's that two-step process. So he might recognize an object. He also will have to maybe take time, another period of time, to understand the item. Like that baby can reach for the rattle, they recognize the object. It might take him, Stephen, a little while to understand, oh, the rattle shakes, makes noise, okay? We know that Stephen likes movement, so he's gonna like mirrors, shiny things, light, and water. He will hold objects 6 to 8 inches from his face, and Stephen has difficulties in new environments, much preferring predictable and familiar settings. So how are we gonna like implement this into his environment throughout his day? So we're gonna use groups of items in a similar class. When we present things, we're gonna use like blocks or balls or toys to present to Stephen so that he can start to distinguish salient features between the objects, okay? Those salient features might be the shape of it. How do you tell a banana from an apple? Well, the color, the shape, the size, okay? Just think about that. We had a really good example last week in one of our lectures, talking about how things in our environment, which we just don't even think about, have been designed for typical person's visual functioning. And then an example that was used was a remote control. Okay? If you look at a remote for your TV, oftentimes they will be, the buttons will be in different colors. Some of the buttons might be placed in a certain area or a certain place. They might have a certain shape to them. Those kinds of things just are everyday items that we use. So much of it has already been like kind of programmed in that we just assume, yep, we could always see this easily. But think if you had a remote control thing that just, there wasn't any labels on it at all, and you had to try to figure out what it was supposed to do. That's kind of the analogy that was given for a kid with CVI. You know, you have to be taught, these kids have to be taught to understand those different distinctions between things. Use experience books with story boxes to introduce and reinforce recognition of objects. Now, these are usually homemade things that you make because you want them specific to that child. And you don't just want, you know, drawings, you want experience books with the story boxes. Those are so you have tangible items that go along with the book, and familiarity with routines and visual memories. So for example, we had to do an experience book, make one, I had to make one for Stephen, and I did one of him taking a shower. And I took pictures of different ways, like of the washcloth and the soap. And then in a box beside that experience book, I would have an actual, I don't know if I'd have a shower head, you could, but I would have soap, I would have a washcloth, I would have a towel, so that he would start to understand the relationship and make that leap from, you know, very concrete to the more abstract. Allow Stephen to hold an object close initially. And if you also remember, Stephen really liked to touch things to understand them. And then use familiar objects with shiny and reflective properties. Work towards new objects, then with those same shiny and reflective properties, and then reduce those properties. And that's how we would graduate up to a higher skill level. Okay, so sometimes we're going to have difficulties, and this is, we talked a little bit more about that dorsal stream, the ventral stream, Well, this would be a dorsal stream area where it's the where system, like where things are at. And so there might be difficulties with visually guided reach or upper limb precision. So for instance, Stephen will locate something, but then he'll look away and then he'll reach for that item. He did that about half the time he attempted to reach for an item. Stephen's visual motor skills improve when items are presented against backlighting, are lighted against a non-complex background, or are presented in a reduced array. So you're going to see these themes over and over again. Strategies to use to implement to help support Stephen would be to support him either in his chair or in an upright support so that he can look at objects within 2 to 3 feet or more closely from 6 to 8 inches. So he can reach out and touch what's in front of him unencumbered, okay? Present objects at eye level and with access to his left visual field. And to provide Stephen with large padded area or a mat where he can maybe just lay or sit and practice reaching for objects so that he's highly motivated to be engaged. So this is an area, especially for the OTs in our class, that they're highly interested in, because generally OT and PT, but they'll do a lot with the visually guided reach and that visual motor connection. And this is something that, you know, just again, to think about kids, if you're seeing kids that are having difficulties with some of this, that would make sense. This is an area. Okay. So I'm going to spend a little bit of time on this. I don't think we probably stop and think about this enough. Like I said, you know, so many things in our own environment are geared unbeknownst to us, but there's engineers someplace designing things to make our life more visually comfortable, okay? To give us better access to things. We take that for granted, okay? Now you've got a child who, you know, it just, I don't know how to explain how necessarily a child with CVI sees. I mean, we've tried to explain that, except that it's just, they might be able to see something, but it just doesn't have the same meaning or context, especially when you get, you know, you'll see that as they get, those characteristics will show themselves kind of the older that they get, or the higher level in school. That's why, you know, I'm always kind of with those junior high and high school teachers with students, really kind of just think about any of the students that you have that phase 3 higher level functioning, they so often get missed. They go through the cracks, they get missed, and they fall through the cracks because, you know, they might be being called autistic, they might be calling dyslexic or a learning disability, when in fact we're looking at something with CVI. So visual fatigue is a real thing. You know how you feel when maybe you've changed prescription of your glasses, or maybe your eyes just get tired. You know, I kind of take that times 100. So these kids will maybe start, like Stephen will avoid looking and he'll just look down when he gets tired. A student that I work with oftentimes will do this. Just cover up. I mean, it's just an automatic. We'll just right away go into this, or start blinking excessively. Sometimes if you see a student who's looking away, that doesn't mean, and maybe the classroom teacher is like, oh, they're not paying attention. Honestly, maybe that's the only way they can pay attention, okay? Is because looking and listening at the same time is too much. So if the child is kind of looking away or closing their eyes, they're able to listen, and that's making sense to them. So in this case, when Stephen gets tired, he may avoid looking or look down, and then he might laugh and get silly, or be fussy, or reject things, or yell, or scratch, or simply not pay attention. And this is where you might start to see that increase of behaviors, okay? In this case, if Stephen is tired, it's going to take him especially long to attend to an object. That latency is going to be even longer than normal. And then what we saw when Stephen was fatigued is he would just turn away, kind of like a refusal. He'd vocalize, he'd laugh, he'd try to do anything he could, right? Socially engage, be silly, a lot of avoidance behaviors, put his head down. He'd purposely do the wrong thing instead of the right thing. He'd try to, he'd look sleepy. He was showing frustration by scratching or squeezing those, making demands. Those are things that, kids will show all the time. We don't necessarily identify that as visual fatigue. It often can be visual fatigue, okay? And I just really want to emphasize that because we don't spend much time talking about kids needing to take a visual break. Taking a visual break doesn't mean a 15-minute break. It can mean, okay, look away for 30 seconds, or you just don't ask anything of that child for just, or distract them with something else for just a little bit. And Lindsay, I've seen you working with a student we have in common. You do an excellent job of this, when they're getting fatigued to kind of, hey, hey bud, let's talk about this for a little bit and then let's get back on task. And that's giving those eyes and that brain just a little bit of a respite period. It doesn't need to be minutes long, but as long as they're getting some kind of rest, intermittent rest, that makes a big difference. In this case, Stephen's light gazing increases with fatigue and complexity, or like most kids, if he's tired or ill, he's going to fatigue much more easily. And that's generally, but here we're specifically talking about visually fatiguing. Okay. So with that visual fatigue, that kind of goes hand in hand with giving visual breaks. Okay. We want to control the complexity in Stephen's environment throughout the day and all of his activities. That will help kind of keep things smooth. Okay. We want to use Stephen's preferred and familiar objects. Again, we can add or apply shiny or reflective materials to novel objects that will help him see. These are all supports that will make life a little easier for him so that he can perform. And that doesn't mean that we want him to have these reflective or shiny materials on his objects all of the time. Like I said, we graduate and then to a new item, maybe that has shiny or reflective material on it, then we kind of take that away. So he can be without that support. And then use backlighting, an iPad or light box to present objects, especially those of a two-dimensional image. Two-dimensional images are just much more difficult for a child with CVI to process. We talked about using a CVI schedule, which is kind of just a daily schedule, like many of you probably are already using in your days, but it's just with a little bit more in mind of giving those visual breaks and recognizing when fatigue is taking place. And then embed the CVI strategies, not just when you have the student, but throughout that student or Stephen's day and environment. So if you have a child that's a 5th grader and they're in the classroom, much of the time, well, then really work with that classroom teacher so that there's consistency, maybe talking about, decluttering or using a softer lighting. It's probably not going to hurt the other kids any, but it will help that kid with CVI a lot. And then, to the folks that are doing speech language, OT, PT, these are all suggestions that can be used when doing those activities with a student and, getting them to maintain visual attention. So there again, I feel like I'm just kind of rushing through this stuff in a way, but I want, and I know you haven't seen particularly Stephen, but I also know that you have students that you can right away be in your mind thinking, oh yeah, it can kind of, that makes sense. And I know I have a student for sure on my caseload who I think I'm almost definitely now certain that has CVI that really hasn't been identified that as that. But so many of these characteristics are there that, you know, even if there's not a diagnosis on hand, it still does not hurt to be using the strategies to help the child with their daily functioning. Okay, I've done a lot of the talking. You guys have any questions? Could you guys get and download that or save that article that I shared with you? Anybody? Thumbs up?
You try to share it in the chat, Jody, because
I did.
it does not have anything from you.
Oh, really? Okay, well, that's weird because I did. Let me try again. I even sent a, oops,
I'm not sure I understand.
yeah, well, me either. Okay, I'm gonna stop